Commissioner Hill, can you hear us?
Yes, I can. Thank you.
Okay, thanks.
Yay! Let me know when you're ready.
We're ready.
Okay. I don't have a gavel, but let's call to order our Thursday, December 15th, Washoe County District Board of Health meeting. And let's go ahead and begin with roll call.
Chair Dare.
I'm here.
Vice Chair Brown will be absent. Tevin Reese.
Here.
Alexis Hill.
Here.
Dr. Dinkle will be absent. Dr. Novak will be absent. Dr. Clacking.
Here.
And I'm your recording secretary. Chair, we have a quorum.
Thank you very much. If you would stand with me for the Pledge of Allegiance. And Barry, would you lead us in the Pledge of Allegiance, sir? To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Let's move on to our approval of the agenda. Does anybody want to move anything or have any questions, or do you have a motion? I have a first.
Second.
I have a second. Any discussion? I hear none. All in favor?
Aye.
And don't see anybody opposed. That passes unanimously. Let's go ahead. We have something very special here today. We have a Washoe County District Board of Health scholarship recipient, Sydney Walters. And if you want to come on up with Gabrielle Brackett, and they're going to share with us a little bit what's going on, and we're going to cheer them on. So out there, the 1,000 of people who are in the audience, we need you to cheer loudly when we're done, okay? Go for it.
Thank you so much. Okay, so good afternoon. Thank you. My name is Gabby. I'm the Development Officer for the School of Public Health. And before I share an endowment update, I just want to thank you all for your support and dedication to our students as an alumna of our MPH program, which Sydney will soon be. It just means so much to see our community partners uplift our future public health leaders. So thank you so much. And do we have slides for the Sydney and the endowment report? Yeah. Anyway, I'll
Yes, her microphone. Is her microphone on? It's just hard to hear up here.
I'm not close enough.
Thank you. There
Sorry,
you go.
everyone.
Appreciate it.
Would you mind switching to the next slide? Awesome, thank you. So as you can see, the market value for, okay. There we go. Thank you so much. So as you can see for 2022, the market value compared to last year has decreased about 1% due to our, as many of you know and feel, our challenging market. But through this, we have continued to provide scholarship awards of around and more than $1,000 to students. Just for your knowledge, the university has revised the distribution policy, shifting to a 12-quarter calculation on a rolling basis with a 2-quarter lag. So I know that's a bit of jargon, but the endowment distribution for the 23-24 academic year will be provided in your next report. But some good news, through the foundation's investment policies, the endowment, like I said, is about down 1%. However, that is compared to a national average of 6 to 7%. So we are working very hard to be strong stewards of our donor dollars that continue to support our students. And with that, I'd like to introduce you to your 2022-23 scholarship recipient, a 4.0, I have to say it, MPH candidate, Sydney Walters.
Welcome.
Hi, thank you so much for having me here. Gabby put together a nice little slide about me, but I also just wanted to come and share a little bit about myself and say thank you to all of you. So I'm originally from the Las Vegas area, born and raised there for the first 18 years of my life. And then I came up here to the Reno area in Washoe County for my undergraduate degree, which I completed at UNR as well in biotechnology, and I continued on into my MPH. And I'm going to graduate this coming spring in May. Some things about me include that I've been really active in the campus community for LGBTQ plus students, and I've helped create and develop UNR's LGBTQ STEM club on campus. I also currently work for my graduate assistantship at the Sanford Center for Aging, which is part of the UNR School of Medicine, where I help deliver evidence-based programs for older adults. And I'm so excited to be able to reach our community in that way. And in May, I'm going to actually start at a position with Northern Nevada Hopes as soon as I graduate. So really, just thank you so much for having me here and for this scholarship and for investing in my future. And I hope to translate that into the betterment of our community.
That is fantastic. And I'd say my own requirement is that you stay here. So I'm glad that's
the
happening. But any other board members want to say anything of congratulatory remarks?
Thank you, Mr. Chairman. I just want to say thank you for choosing to stay here. It's often times that people will come out of Las Vegas because they want to get away from what they've known for their life. We sent our oldest the other direction, of course, down to Las Vegas, and they're now in law school. But thank you for the work you're doing, especially on campus. The visibility piece for the LGBTQ community continues to be a challenging one. And of course, Hopes is amazing, and hopefully you'll do great things over there. Congratulations.
Thank you so much.
Commissioner Hill or Dr. Clacking, do you have anything you'd like to share?
I'm just so impressed with you, Ms. Walters. Thank you for giving back to our community. And I can't wait to see what you accomplish. And please remember that you've got the support of your local governments here, Washoe County, Sparks, and Reno. If you need anything, you can always reach out to us, and you inspire me. So I appreciate all you're doing.
Thank you so much. I really appreciate that.
Very good. Well, don't go too far. We're going to take a picture with you here in a minute, I think. So please stick around. Thank you.
Thank you so much.
And we have our health district officer with some years of service and hires, and I even see resignations, which we don't like seeing those, but go for it, brother.
All right. Thank you, Chairman. I'd like to begin with our new hires, and I'd like to begin with Jack Zentino. Jack, if you could please stand up. I've lost track of you out there. There he is. So Jack is our new Administrative Health Services Officer. I'm very pleased to announce. You may recall you met him briefly at the strategic planning meeting, but I did not have a formal introduction for you. Jack has got a Bachelor's of Science from UNR, and he has 15 years of experience with DHHS, with public health on the ground, and then higher level positions in the welfare and Medicaid programs. So he joined us on November 7th and is rapidly getting up to speed and is in the midst of the FY24 budget preparation for the health district right now. So thank you. Congratulations, Jack, on your new position. And then I would like to ask Ms. Lotritz if she could do introductions for us for Leah Gardner, a public health nurse, and Mary Beth Reeve, a APRN in CCHS.
Good afternoon, Lisa Lotritz, Division Director for Community and Clinical Health Services. I would first like to welcome Beth Reeve, APRN. Beth has been a nurse since 2009 and has a variety of experience, including med-surg nursing, oncology care, and student health nursing at UNR Student Health Center. And at Washoe County Health District, she was with us per diem before she came on permanently. Most recently, Beth graduated in May of this year from UNR with her master's in nursing, family nurse practitioner track. Beth has been working as per diem APRN in the Family Planning and Sexual Health Clinic since June and has excelled in that role and literally hit the ground running day one. So we are so excited to have her. And I have Leah Gardner here. Leah started on November 21st as a public health nurse in our immunization program. Leah has a bachelor's degree in nursing from the University of Nevada, Reno, and has worked as a bedside nurse for 31 years, the last 22 years in critical care. We are glad to have both of them on board.
So glad you're here. And to all three hires, I just want to say we know there's plenty of places to work these days in the medical field, and we thank you for joining us. So appreciate it.
All right, moving along, I wanted to announce a couple of resignations that we have. Joseph Crump, public health nurse, has left us effective the 23rd of November. And Kat Olson, environmental health specialist, resignation effective October 28th. And I want to wish them both the best in their new endeavors. We have a couple of retirements. Dawn Spinola, who is administrative secretary with the Health District. Earlier in her career was the administrative secretary for the Board of Health, but resigning from EPHP, her retiring. And Judy Medved Gonzalez, who also has resigned from CCHS, and I believe Dawn Spinola had 22 years with the Health District, and Lisa helped me at 25 years for Judy Medved Gonzalez. So congratulations to them on their well-deserved retirements. And then we have a number of Washoe County Health Heroes to recognize. This is our employee recognition program, and many of these are nominated by their peers. Robert Chisel and Katie Doyle are not able to join us today because they are busy with their duties with the community pods that we're still doing for the COVID vaccinations, so that they were nominated and awarded for their professionalism. Jamie Starr, who is also working with our COVID response. Jamie, if you could stand up, please. Jamie is recognized for trustworthiness, professionalism, and partnership and collaboration. So thank you. Congratulations, Jamie.
Yeah.
Rachel Cord, I heard that Rachel may not be able to join us today, but Rachel was awarded for trustworthiness, professionalism, and partnership and collaboration. Jessica Cabrelas, who's not able to join us today, is also awarded for trustworthiness, professionalism, and partnership and collaboration. Manuel Coronado, could you please stand? There he is. Manuel, congratulations, recognized for partnership and collaboration. And Rachel Ladd, please stand, recognized for professionalism and partnership and collaboration. Latricia Lord with EHS, thank you, Latricia, is recognized for partnership and collaboration.
Good job.
And next to her, Krista DeBraga, also with EHS, recognized for partnership and collaboration. Congratulations. Shayna De Silva, back over by Jamie, is recognized for professionalism. And we have a number of honorable mentions. Marissa McCune with Air Quality Management, Lilia Huffman with CCHS, Sahara Cruz with CCHS, Kalisa Shireen with CCHS, and Joseph Crump with CCHS. So thank you to each of those employees also. So.
A lot of heroes. Wonderful.
So that takes us to our proclamations.
Yeah.
I will run down to the podium.
When do we do the years of service for Kelly?
Did I miss that?
We didn't do that the first one.
I am so sorry.
Well, that's why I'm here.
Skipped over that on my list. Thank you. That's why I like to have a chairman as a backup. Kelly Goatley Seals. So Kelly is being recognized for 20 years of service. And,
Okay, give her a big hand. Come on.
Thank you.
And when you come up for, I have something special for Kelly when we get there.
Okay. Is Kelly here? So if I could ask Christine Kelly, who's the program manager with the UNR Reno Extension Program, to come up and join me, as well as Craig Peterson with Air Quality Management.
Hello again.
Whoops. So we have a proclamation today for National Radon Action Month. Whereas many Washoe County residents don't know about radon, yet need to know for the safety and health of their families, as radon is a colorless, odorless, naturally occurring radioactive gas that is the primary cause of lung cancer among non-smokers and the second leading cause of lung cancer in smokers. And whereas the U.S. Environmental Protection Agency estimates that 21,000 people in the U.S. die each year from lung cancer caused by indoor radon exposure, and lung and bronchus cancer kill more people in a year than any other cancer. And whereas radon kills more people than secondhand smoke, drunk driving, choking, drowning, or home fires, and whereas any home in Washoe County may have elevated levels of radon, even if neighboring homes do not, and living in a home with an average radon level of 4 picocuries per liter of air poses a similar risk of developing lung cancer as smoking half a pack of cigarettes a day. And whereas testing is the only way to know if a home has an elevated radon level, and testing is easy and inexpensive, and when identified, homes can be fixed. And whereas the University of Nevada, Reno Extension's Nevada Radon Education Program and the U.S. Environmental Protection Agency support efforts to encourage all Washoe County residents to test their homes for radon, mitigate elevated levels of radon, and have new homes built with radon-reducing materials and features. Now, therefore, be it resolved that the Washoe County District Board of Health does hereby proclaim January 2023 as National Radon Action Month in Washoe County, Nevada, adopted this 15th day of December 2022. Christopher Dare, Chairman, Washoe County District Board of Health. And I have a certificate for you. There you are. And I'd welcome you to make any remarks if you'd like.
Thank you. Considering that Nevada does not have any laws that mandate radon testing or radon mitigation, proclamations are really important to get the word out about radon. I really appreciate the invitation to come and accept this in person, and I appreciate the proclamation.
Very good. We're going to come down and take a picture with you, so don't go too far.
Okay.
We ready for that?
But first, you need to vote, I believe.
Oh, well, we do need to vote. That's true. See, that's why you're here, is to help guide me. So I'm looking for a motion to accept this proclamation.
I'll make the motion. Rika Danko.
I have,
Second.
welcome. And we have a first,
Thank
have a
you.
second?
I second. Reese.
We do have a second. Any other conversation? I hear none. All in favor?
Aye. Aye.
It sounds like it passes unanimously. Thank you very much.
So we like to do pictures now?
Sure.
Why don't we start with the proclamation, since you guys are already down here, and then we'll go to our scholarship recipient. We're going to go inside the well. Here.
Big smile.
Okay, 3, 2, 1. Good. All right.
Congratulations. We have a couple.
And then
Kelly. She left.
Thank you.
Yeah, she said she would be in and out. That's what I was kind of weird about. About
And then we'll grab Jamie, we'll get you, and Manuel. Tricia. Kristen and Jamie.
Christmas cards they do with a dog. Do we take all together?
I think we're, how do we do this?
Yeah, let's do all together. Great. Thank you. I was gonna say, you all should be in the middle round. We'll be on the outside. All right, come on in. It's all about y'all. You did good. So cool. You're heroes. I think we should get capes. What do you think? Yeah.
Wait, you got the long Rachel.
Definitely not Rachel Ford. She's gone. My question is, when's lunch? There's a lunch coming.
Alright, here we go. 3, 2, 1.
Actually, we probably should announce it, just because if she's voting, then there's no question. So let's go ahead and say she's here.
Yeah, Dr. Denko, well, actually, she's off now, but she did come in at 1:03 and left at about 1:20.
No, I would just announce it so it's on file, and then if she's voting, people aren't wondering who the mysterious vote might be, so.
Yes, I will make sure to let you know if she logs back on.
But for the record, if anybody's wondering, we have a quorum with or without her, so her coming is just an extra special guest, so it's nice. Okay, we are on to public comment. Do we have any public comment?
We do not have any public comment.
Okay, we'll move on to 8, our COVID-19 flu RSV update and information, and this goes to Kevin Dick.
Yes, thank you. I'm going to begin with RSV. We reported 211 cases last week. That was down a little bit from the 263 that we had the week before, but we've had sort of a sawtooth curve as our RSV cases have increased so far this season. So we may well go higher. I think it's too early to say whether we're peaking here, but nationally it looks like RSV has peaked. It hit other parts of the country earlier in the season. But here in Washoe County, we've had 1,224 cases so far this flu season. So that's just since the beginning of October. Normally, we have about 750 RSV cases for the entire flu season, which runs through the first 20 weeks of next year. So we are still early on, and we have a phenomenal number of cases that have happened. We had a higher than normal season last year, and we had under 1,100 cases for the entire season last year. It's interesting that in Washoe County, we have an RSV case rate of 53 per 100,000 population, and we're at 3 times the rate roughly for the rest of the state as a whole. The next closest health authority for RSV cases is Carson City, that's reporting 28 cases per 100,000, and the state as a whole is reporting 18 cases per 100,000. So Washoe County is really getting hit with RSV. And for flu, for the week ending December 3rd, our hospitalizations increased. We had 54 hospitalizations that week. Since the beginning of October, we've had 133 hospitalizations. And we now have 4 flu deaths that have been reported for the season, and 3 of those occurred that week ending December 3rd. We in Washoe County are about a 28% vaccination rate for flu. So we really are urging people to get vaccinated for the flu. Nationally, the state of Nevada is rated as high for flu cases occurring, and nationally they're talking about this being the worst flu season in 10 years. And for our COVID cases, our reported cases are at 55 for the 7-day average. That's down slightly from last week, but we really have an incomplete picture with the reported cases because of all of the at-home testing that's occurring. Our wastewater concentrations actually increased for the week ending December 3rd, which would indicate we'd have increasing cases occurring. Our community level remains low, though, because our hospitalization, the hospital impacts from COVID-19 are low, with only 3.8% of staffed beds being used for COVID patients. Just today, I believe it was, the federal government announced that they're now again providing free COVID-19 tests, and households can get up to 4 tests by going to the covidtest.gov website. The real issue that we're facing in our community is the triple threat of RSV, flu, and COVID, as well as other respiratory viruses that are going around. And so while the RSV cases are accounting for about 20% of the cases occurring in our pediatric wards, with all of the other respiratory viruses, our pediatric wards are full, our NICU and PICU units. The state has worked with the nursing board to allow for very rapid granting of temporary licenses to out-of-state nurses, and they've also made it easier for the hospitals to increase their capacities in their pediatric units by just notifying the state of the capacity increases that they are implementing. But right now, Renown is our hospital that has the pediatric ward and the NICU and the PICU units. With just yesterday, Sierra Medical Center, the new Northern Nevada medical facility, announcing that they were going to be opening pediatric ward. My understanding is that's going to have very limited capacity in December, but it will be expanding in January, so that's good news. And I think the bottom line is just to recognizing that we have all these viruses circulating. It's the holiday season, people are getting together, so it's important for people to stay home if they're ill and not share their sickness with others, to be washing hands frequently, cleaning those high contact surfaces. If people wish to wear masks, we know they do work to help prevent the spread of viral respiratory diseases, and well-ventilated spaces for gatherings are still recommended. So that's my update with where we're at.
I want to thank you for the update. I want to, for anybody in the public wondering what we do at this moment, our goal is to educate to the best of our knowledge to you and to make sure that you can get the best information right here at the Health Board. I think that's one of our number one goals. I do want to say to our board, I've been talking to to our head of our hospitals. Renown will be opening up in January for a small tour for us to get to see what they're doing with pediatrics. And we'll continue down that road with any other group who steps up. I think it's our job to keep an eye on our health across the state, across our area here in Washoe County. And one of those is obviously what's happening with our pediatrics. So that's coming, and I'll get more information on that. Okay, let's move on to our, any questions on that before we move on? We good? Okay. Consent items, we have 9A through D. Anybody want to take one out of consent, or we have approval?
Move to approve the consent items as posted.
We have a first. Have a second?
Second.
Who said that? I think Clacking beat you. We're going to let Clacking have that race. And any other discussion? All in favor?
Aye.
Aye. Any opposed? I hear none opposed. That passes unanimously. Let's go ahead and. Oh, I'm sorry. Yes, we're back to voting on here. Did you vote on your thing? Okay. Okay. We are on now to number 11. It's a recommendation to not increase fees by the Consumer Price Index for the air quality management and environment. Did I miss one? Oh, I totally jumped over REMSA. Sorry, I don't want to do that at all. Come on up. 10A, we have review and acceptance of the REMSA Health Operations Report for October 2022 and November 2022. Barry Duplantis. Welcome, sir.
Good afternoon, Chairman Dare and members of the board. I am Barry Duplantis, Interim CEO, President of REMSA for the record. I'm providing you with a copy of REMSA's October and November reports. At this moment, we were not able to collect all of our data gathering in advance of the posting deadline for today's meeting, so the reports are being distributed to you as we speak. I would like to highlight that for the month of October, REMSA was compliant with priority 1 calls in Zone A, but fell short with 89% compliance in zones B, C, and D. For the month of November 2022, REMSA was fully compliant with priority 1 calls in both zones A as well as B, C, and D. For the year to date, which is what is stipulated in our franchise agreement, REMSA remains compliant with year to date 90% in zones A as well as B, C, and D. As noted in the report for the month of October, REMSA responded to 7,904 calls. Of that 7,904 calls that required a response, REMSA transported 4,893 patients to area hospitals. This is a transport rate of 62%. As noted in the report for the month of November, REMSA responded to 7,767 calls, and of those calls, 4,932 patients were transported to area hospitals. The transport rate for November was 63%. We continue to experience year-over-year growth in the demand for 911 EMS services as our community grows, and many in our community use 911 to access health care. And a fair number of our patients are being transported to advanced levels of care. As District Health Officer Dick reported just a moment ago, we are seeing certainly a rise in respiratory issues as well as cardiac with the weather and the respiratory illnesses that are prevailing. So we certainly have been year over year busier. In fact, to be specific, in the month of November, we were 11% higher than we were in the previous November. As required in RIMS's franchise agreement, we engaged an independent accounting firm to review our financial statements, and that report should be delivered to us on Monday. This Monday coming up, I believe that's the 19th. So we will be sharing that with you shortly. With that said, I'm happy to address any questions you may have with regard to the report that reports that we presented to you today.
Any questions? Concerns?
Thank you, Mr. Chair. Mr. Duplantis, I just am sort of thinking longer term about the reporting requirement. And so at some point in time, I think it's important that we have a conversation as a body about how often you've come to report each month. And I understand the concept of making sure that you're accountable. I see the reports each month, so I see your progress one way or the other. So in my mind, that is some level of accountability. But I also imagine that it is some effort to make the time to both gather the data and then come each time, which might otherwise be spent elsewhere. And so for my part, I appreciate the updates. Certainly if there is a moment where I think that REMSA is, not following their contractual or other obligations under the franchise agreement, we'll have a conversation about it, and I'll try to get to the bottom of it. But for my part, I just am not sure how beneficial it is for me to each month hear you say, we're up, we're down, we're sideways. So in the future, I think it's just something worth talking about as a body, especially because I think the data proves that a lot of good work is being done by REMSA. So I don't want you to feel as though my inquiry is punitive in nature, but simply that I worry about the necessity of having such a report with such frequency. Maybe it's something we can do quarterly. A number of different bodies that we serve on have people who come to make presentations or reports of their goings on, but very rarely are those done on a monthly basis. I don't know all of the history because I'm relatively new to the board. I think I'm the newest member. So forgive me if my naivete is showing. But again, I think that we can probably deal with less reporting from my standpoint on this particular item.
Definitely for a conversation. We can consider that. I think there's some things that have to do with our actual agreement that require some of this, for sure. But I think it's definitely something we can look at. Any other questions? Okay, I'm looking for a motion to accept.
So moved.
Second, Reese.
First and second, any other discussion? I hear none. All in favor?
Aye.
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 Passes, I believe, unanimously. Very good. And we continue now hearing from REMSA with their recommendation for the board to uphold, I'm sorry, I'm right here. Recommendation to accept the REMSA corrective action plan update due to the notice of non-compliance. Go ahead.
Okay. Again, my name is Barry Duplantis, interim CEO of REMSA, for the record. I'd like to provide you with a little bit of an update as to some of the remedial steps that we have taken to bolster our compliance initiatives. At this point, REMSA employs 589 people, so we're just a few people shy of 600 people, the largest workforce we've ever had in the history of the company. And we continue to need more clinicians, quite candidly. I'd love to see us be able to hire 12 people. The people are not available. That's the issue. We are aggressively trying to add to our workforce, and we will continue to recruit and develop people for service in our community. A couple of things, or I should say maybe a handful of things that we have done. We've reinstated a 2013 on-call policy to provide additional bench strength for when folks call in sick. We have people ready and available to fill seats and serve. We've reassigned our community paramedics to 911 ALS shifts. We've requested that all employees throughout the company who hold clinical qualifications assist with the 911 responses. We've implemented PTO incentives to encourage people to pick up additional shifts. We continue to collaborate extensively with the local fire agencies to encourage fire employees with clinical skills to work for REMSA with some of the per diem shifts that we have available. We have increased our hiring incentives, and that's also true about other EMS agencies around the nation. We now offer spot interviews for students that are in our EMT and AEMT postgraduate school programs. And we certainly continue to be a very active participant in the community-wide regionalization of 911 services. Quite candidly and simply put, our goal is to make REMSA one of the best places to work. We want people to have no reason to leave our company. In addition to boosting staff levels, I should point out that we meet daily to review prior day activity, and we make real-time adjustments with regard to the placement of our ambulances in the community. Every day is a new day for us. There's no pattern that we can always point to that says this is the secret sauce to always having an ambulance perfectly placed. Calls will vary as to what parts of the community are hot spots each day. With that said, we're certainly vigilant to the deployment of our resources, and I'm happy to address any questions you may have with regard to this subject.
So my main question on this, and how long do we continue to get the non-compliance report? When does that end? Is that something we choose of when you've hit the compliance, or is there a certain amount of months? Or?
That is correct. It's the discretion of this board. In fact, I think the motion that's associated with this item is to, in essence, enable REMSA to combine this report with the general report that we provide you.
Yeah, and that's what I wanted to kind of get to and say, well, I think you guys have responded correctly, and I appreciate the information you've given. And I actually have seen everything you just said you're doing, which we all see it, and we appreciate it. And so do understand that part of what we're asking, there was a time when we asked for some very clear direction and from some clear reporting, and now we're potentially pushing this together. So want to make sure our boards are aware of that conversation. So any questions? Thoughts?
Mr.
Okay.
Chair.
Yes, sir.
I just wanted to clarify that, so the recommendation on this item is to combine this with the monthly reporting that we just had from REMSA, but we would modify the agenda item a little bit so that it would allow for the Board of Health to provide any direction if they chose to do so based on the report, not just accepting the report.
Well, and I'd say it's still wise to have some of that in there. There's so much transition going on in our region, a lot of conversations going on, and we want to be there to assist and give you confidence as you run forward too. So I think that's appropriate. So with that said, I'll be looking for a motion if there's no discussion.
So moved.
I have a first and a second. Any discussion? I hear none. All in favor?
Aye.
Aye.
And passes unanimously. Very good. Now we have our update. Thank you.
Thank you.
We have our update of REMSA Health's public relations during October 2022 and November 2022 by Alexia Jobson.
Good afternoon, Mr. Chairman, members of the board. Alexia Jobson, Director of Public Relations for REMSA Health, for the record. And as you mentioned, you have for your review the public relations report, and I have a few more recent updates for you. Just before Thanksgiving, our education manager, Jenny Walters, provided an interview to KTVN about the importance of hand washing, properly covering your cough and sneeze, and staying home if you are sick, especially as we are in the holiday season. In late November, we partnered with the Nevada Hospital Association to create social media content that encourages youth and young adults to consider healthcare careers, from paramedics and EMTs to emergency medical dispatchers to flight nurses. So you'll be able to see that on our platforms as well as theirs. In early December, a few of you were able to join us for a community leader open house where our interim CEO, Barry Duplantis, had the opportunity to share his vision for the organization and how it will continue to best serve the needs of Washoe County residents. In addition to a short presentation, several of our leaders provided attendees from the community with tours of our education department, logistics garage, and regional emergency communications center. As a reminder, you are all invited anytime to visit the Edison Way campus or schedule a ride along. In support of the Washoe County Health District's efforts to curb the spread of all respiratory illnesses this season, but especially RSV, I am working with Scott Oxerart at the county on developing a paid public awareness campaign to encourage the public to use proper patient navigation through pediatricians and urgent care locations to address symptoms of RSV. We anticipate that you will start seeing messages related to this campaign on digital platforms before December 25th. We are proud to say that last week, Remsa Health supported the efforts of the Food Bank of Northern Nevada through a food donation of 600 pounds, as well as a staff and organizational cash donation at the KTVN Share Your Christmas Drive-By Food Drive event. And lastly, earlier this week, Adam Hines provided an interview to KTVN about staying safe in winter weather, shoveling snow, driving and walking, and to seek treatment for minor injuries related to inclement weather through a primary care physician, an urgent care, or a telehealth visit, and to preserve 911 and emergency rooms for things like chest pain and serious traumatic injuries. I'm happy to answer any questions you may have about our public relations work.
Any discussion or questions? I think my only question to you is continue to know that I think we're all ready and available to come alongside in any capacity. I mean, you just mentioned one of the areas we're working together, but continue to know that we're here for you.
Thank you. And in the new year, you will be hearing from us about some ways that we can get the board involved.
All right, thank you so much.
Thank you.
And do we need to accept this? No, it's just report. Okay, on to 11. Now we're on to recommendation to not increase fees by the Consumer Price Index for the Air Quality Management and Environmental Health Services Division for fiscal year 2024. Jack Centenino, but Kevin Dick is going to go ahead and begin this.
Yes, thank you, Chairman. So in 2015, when the board adopted the fee schedule for air quality management and environmental health services fees, in that fee schedule, wisely, the decision was made to adjust the fees by the Consumer Price Index each fiscal year. And we have been delayed in our ability to review the entire fee structure and bring a report back to the board on all of the fees, largely because of the COVID pandemic and the disruption that's had to our operations and our ability to assess what our indirect costs are in normal operating environment and other operational fees associated with those. Those that were on the board earlier in COVID will recall we actually just redeployed everybody to be responding to COVID. What we have recognized, though, is that our salary increases, cost of living increases, have not kept up with the CPI schedule. And so what we're proposing is for this coming fiscal year, we think that we can avoid a CPI increase within our fees because of that. And so we're recommending to the board that you not have that CPI increase in the fees for the FY24 fees while we continue to work to bring you a review of the entire fee schedule. So basically our business community would get a holiday from the CPI increase, and we think that that would be beneficial to them as well with all the costs that are going up currently out there. This isn't to say that we wouldn't bring you any changes to our fee structure, because we are looking at some other adjustments to fees that we think would make sense in the short term. But we do plan to do that comprehensive review and bring that forward to you in the future as well.
Thank you. Any questions? I hear none. And I do agree. I thank you for that approach and look forward to just seeing what we discover as you guys continue. I think having the leniency to figure that out, bring it back to us is the key. But can I have a motion on this then?
So moved.
He beat you to it. Would you like to be our second?
Yes, Mr. Chair.
Thank you. Ms. Hill's our second. Any other discussion? With that said, all in favor?
Aye.
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 It passes unanimously. Okay. We have presentation of possible acceptance of the FY24 to FY26 strategic plan. Ms. Julie Reddy, I know you've worked diligently on this, your whole team, and you guys deserve hero awards just for this, but welcome.
Thank you, Chair. I appreciate the compliment, and then would just say that really we just deserve, we're just lucky to be the conduit for all the other heroes in the health district who actually do the work with the public, protecting our health. So I'm going to move through this relatively quickly because you all participated in a 4-hour strategic planning session where you saw all this, but in our due diligence to make sure that we're transparent with the public, we wanted to give a quick overview. So again, my name is Julia Ratty. I'm the Director of Programs and Projects for the Washoe County Health District. As a quick reminder on the process, we started our planning process in mid-July with an all-staff survey. In August and September, we convened our strategic planning committee and they started reviewing the draft mission, vision, and values statements. In October, that strategic planning committee continued to work and brought recommendations forward that were presented to the staff and division directors. They also got to hear about our community health assessment, our community health improvement plan, our health equity committee recommendations, and division recommendations, and those were incorporated into the draft plan. And then finally, we brought it to you at the District Board of Health retreat. You had the opportunity to review, comment, provide your input, and that brings us to where we are today, which is the formal approval of the plan. You may also recall that there were many different efforts that became inputs to our strategic thinking and our strategic planning process. And just as a quick reminder, those included the community health assessment, a health equity focused listening tour, the community health improvement planning process, our health equity organizational capacity assessment and plan, and a project that we're working on foundational public health services, a workforce capacity assessment in conjunction with the Public Health Foundation. This is just a reminder of that CHA and CHIP process that included a significant amount of community engagement. So started with the informing, the collecting of information through a survey and focus group process, the organizing and analysis of that information. Of course, our wonderful epidemiological team looking at all the existing data, narrowing that data and doing the analysis on that, both primary and secondary data. Then in the yellow, you have the health equity listening tour, and then in the green, the CHIP planning process where we convene the community again to help us set our priorities based on what we learned from needs in the community health assessment and start our prioritization process on our CHIP planning process. Out of that came our 4 focus areas for our community health improvement plan, which are mental health, preventative health behaviors, access to health care, social determinants of health, and then an understanding that there are some cross-cutting considerations around language, accessibility, and transportation that should be considered in all of our efforts when it comes to the community health improvement plan, and a commitment to a special initiative around language accessibility. Then you also heard about our health equity organizational capacity assessment and plan. So lots of learnings coming out of the pandemic response and really in our history in public health that there are certain parts of our community that unduly carry a larger burden when it comes to health disparities. And this is about strengthening our internal capacity as an organization to address health equity and address health disparities. So you heard presentation from Tiffany Young, our consultant, as well as our health equity committee. And then finally, from the Public Health Foundation, we took a dive into the foundational public health services. So this is sort of a national agreed upon framework, or what are the essential or foundational areas, capabilities, and then community-specific services that we need to be paying attention to make sure that we are resourcing appropriately. So with all of that, it poured into this part of our plan. So we updated the mission. So the current mission is on the left and the proposed new mission is on the right to improve and protect our community's quality of life and increase equitable opportunities for better health. We also reviewed our values. Our current values are on the left. Our proposed new values are on the right to be collaborative, adaptable, trustworthy, inclusive, and compassionate. And then you may recall that we added some description of that so we could bring those values a bit more to life within the organization, as well as when we're explaining to the community what our organizational values are. The 6 strategic priority areas where the health district focuses, so healthy lives, healthy environment, local culture of health, impactful partnerships, organizational capacity, and financial stability. We did not change any of the overarching themes, but we did change a few key words. So in our impactful partnerships, because of our values discussion, the Strategic Planning Committee recommended adding the word collaborative. And then in our financial stability, we wanted to make sure that the message we were sending to the community was correct. And so we reworded the language to enable the health district to make commitments in areas that will positively impact the community's health through reliable and sustainable funding. And so wanted to make sure it's not just about growing money or getting more money, it's about making sure that we are doing a good job of making commitments that will address their health, but it's through a reliable and sustainable funding source. Adjustments to goals, I'm not going to go over all of those. There are quite a few that you reviewed. You'll remember the rainbow sheet with all of the different goals adjustments, but in big buckets, these are the kinds of things that were changed. We added injury prevention to the chronic disease prevention activities. We broadened the focus from COVID-19 to include other emerging disease threats. We're hearing about monkeypox or Ebola or any of the other, whoever knows, whatever next is coming down the pike. We emphasized targeted outreach to underserved communities and utilizing community organizing principles to improve health equity. So how do we engage the community in our efforts to address health equity and health disparities? We talked about advocating for health in all policies, that some of the many factors that affect our health in the community are actually policies that are set at cities or counties or the state, and how do we work with those entities in partnership to make sure that we are improving the health for everyone. We talked about expanding air quality monitoring in the existing plan. It talks about school sites, but we're doing a lot of work on community-based sites. And then in our partnership section of the plan, there were quite a few updates to align the partnership section more closely with the new CHIP priorities. So again, preventative health behaviors, social determinants of health, access to health care, and mental health. And then finally, with the news of the ARPA award, there will be some significant activity around improving and expanding facilities. So those were the major shifts in the district and division goals. That's it. You have the full plan in your packet. If you have any questions, I'm here and ready to answer them, and I look forward to your feedback.
Thank you, Ms. Ratty. I think, as I said during our workshop, very impressive work that your team has put forward. I know that it's hundreds, if not thousands, of hours that go into getting to this moment. So it's just really a moment of thanks from me to your team for the work that went into it. Especially in my case, I had to read all of it because I knew enough that I needed to understand what the goal of the body was and what the vision was. And so it really is the sort of the onboarding tool that would be necessary for someone coming onto the body to understand. So it's very impressive. I appreciate, again, your effort. I'm just blown away by it, so thank you for that.
Ms. Hill, do you have anything?
Oh, thank you, Mr. Chairman. I just wanted to commend Mr. Dick and Ms. Ratty for their work and their team's work. And I know that what I really loved about this process was it was rooted in the work that the staff does. And so I was just very impressed, and I learned so much, and it got me fired up. And I would say it was one of the best strategic planning sessions I've ever been to. So I just commend everyone, and really looking forward to the work ahead of us, and can't wait to see how I can help support it.
And Dr. Klatkin, I'm not sure if you had something you wanted to share. Can't hear you yet.
There we are. Sorry. Okay. Yeah, I just wanted to add into that it was a tremendous meeting. I think it was, last year was great. This year was even better. So I'm all in whatever I could do to help out to push this forward.
So my only real comment is how to get this out into the community to where we are working collaboratively. I mean, and that would be, you've done amazing work, but it does no good if it sits inside of a vault. And I say that not that people aren't wanting that information. I would just say, please, if there's anything we can do to help get that out there within our jurisdictions or whatever, please lean into us a little bit more and know that we're ready to try to get some of this information out if it's not out there already.
Great. Well, thank you again. I'm a little overwhelmed by all the positive comments, and I would just say you get to see me and my team, but the real gratitude goes to And, like taking it from the top, every employee that took the time to fill out the employee survey, the employees who raised their hand to volunteer for the Strategic Planning Committee and the Health Equity Committee and all of the work that came behind that. All of our supervisors and all of our leaders for all of the work that they're doing around making sure that their programs are on point and what the community needs. We collaborate with our community in many ways. So you hear a lot about the CHIP, but if you think about just as an example, the emergency preparedness work that you see with our collaboration with REMSA, or there's just so many ways. I don't want to try to list them because I will leave people out. So this product is a representation of the work that every single one of the 160 plus employees here at the Health District, and where we've missed some, we're trying to continue to build that in and be as inclusive as possible. But just know that, yes, there were hundreds of hours, but there were hundreds of hours spread broadly across the Health District, and we're thrilled to have that kind of engagement, and they really deserve the credit.
Thank you. Do we need an acceptance of this for this round? So we are looking to have a motion on this so we can accept officially.
I move to accept the fiscal year 24, fiscal year 26 strategic plan.
Second.
Thank you. Thank you. Any other discussion? Hearing none, let's vote. All in favor?
Aye.
Thank you. Any opposed? I hear none. This passes unanimously. Thank you again. We're on to recommendation to approve the proposed 2023 Washoe County District Board of Health meeting calendar. So we want to do this more in the future. How do we do that, Sir Health District Officer?
Thank you, Mr. Chairman. We've provided in the packet a proposed calendar for the Board of Health meeting dates. And so these are consistent with the schedule that we've had in the past as far as the fourth Thursday of the month at 1 p.m. With an adjustment to the schedule for the months of November and December. We are in November proposing to have a strategic planning meeting again. And so we're proposing to have that on the second Thursday of November. That will allow us to avoid the week that the National League of Cities meets that some of our board members attend. And then we're scheduling tentatively a regular meeting in November, though, that third Thursday, so that we can avoid Thanksgiving. But traditionally, we've been successful in canceling that tentative meeting. And then because of the Christmas holiday, having the December meeting on the 14th of December at 1 p.m. So that's our proposed schedule for Board of Health meetings for next calendar year.
Very good. Question I have, I thought we had on our agenda this time a conversation regarding our name change.
That was in the consent agenda for
okay.
the rebranding.
Sorry, I'm getting to the end of my meeting and I'm all, the one thing we said we had to do. I got scared there for a minute that we all missed. Thank you. I appreciate that. Okay, well, moving on now to, we do need to accept that possible action. So is there any questions or concerns regarding that particular, our calendar? So can I have a motion?
Move to approve staff recommendations.
We have first.
Second.
We have a second. All in favor?
Aye.
Aye.
Any opposed? And that passes unanimously. Thank you. We're on to our staff reports and program updates. I do want to remind all our board members, as Francisco makes his way up for our air quality, is that there will be a conversation coming trying to help kind of include all of our staff with a board member helping us to dive in a little deeper. So that's coming. So you might want to listen to all the fun going on because see where you want to land. Thank you.
Mr. Chairman, just a point of order. Are items 14 all non-action items?
14A through E, they're non-action.
Thank you so much.
Yes.
Thank you, Chairman Dare, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. I did want to highlight a few things in my report. Firstly, in my report, I did provide a letter from EPA communicating a request to submit an exceptional events demonstration package for PM10. And again, in my report, I did state that in 2001, parts of Washoe County were designated serious non-attainment. And fortunately, through excellent programs like our wood burning device programs, our dust control programs, and our stationary source permitting, we were able to get back into maintenance in 2015. So the process from there is 10 years after that designation, we have to submit another maintenance plan. So that's where we're at right now. As part of that, and primarily due to wildfire smoke, we have to submit this exceptional events demonstration package. And as I explained in my report there, if this is not something that is submitted and approved by EPA, there may be potential there for a designation of non-attainment again. So again, exceptional events demonstration package is a difficult process, one that requires a specific skill set. And again, we have gathered some feedback from consultants that do this type of studies. And again, it's looking in the $300,000 to $400,000 range. We are also assessing if this is something that we can do in-house and if we can take on this additional workload. So again, we're taking a look at all options, but did want to provide that information.
Thank you so much. Any questions for Director Vega? Thank you so much. Keep up the good work.
Thank you.
Appreciate it. And let's go ahead. We do have Miss Lisa Latritz. Did I say that right? I got to make sure now I got to pronounce everybody, so I'm like paying attention to last names here. But this is our Community and Clinical Health Services.
Yes.
Thank you.
Good afternoon, Lisa Latritz, Division Director for Community and Clinical Health Services. And you have my report for your review. The only two things I would like to add is that our opt-out syphilis project, which is a collaboration with the Washoe County Sheriff's Office, was delayed due to some contractual issues. Those have been resolved, staff has been hired and trained, and we are getting that. It's ready to start on Monday for the testing, so we're excited about that. And then our family planning, our walk-in, we were doing it every Wednesday, has been so successful that starting on Monday, we will be having walk-ins Monday through Friday, all throughout the day, so that clients can come when it's most convenient for them. They can also make appointments, but it's an additional option for them. And us having Beth, who you met earlier, on board has made that possible. So, and that's all I have, but I'm happy to answer any questions.
Any questions? None. Thank you so much. Thanks for all your work. Appreciate it. And we have Erin Dixon, and Environmental Health Services Division Director. Come on down. You're the next contestant.
Good afternoon. For the record, Erin Dixon, Environmental Health Services Division Director. You have your report in front of you. I just want to highlight a few items. There's a description of how our team, we talked about this a few times, how our team was able to go and was asked to be a mentor to both Guam and Saipan, and a little bit about their experience, why they were there. They have been asked to also mentor them for the next year by the FDA and NACCHO, and that is a great opportunity for our team to also not only provide the level of expertise that our team has to another area, but also to learn about some of the challenges that occur in some of those small islands as well. For our commercial plans, I would like to highlight that for the first time ever, more than 1,400 commercial plans were submitted in a calendar year. That is as of the end of November, and we are still collecting plans as through the end of this year. So huge kudos for the team for staying on top of those plans. There's a blurb in here on training. Our two most recent environmentalist trainees, Erin Myers and Lauren Clapman, who started in September. Their training is going incredibly well. Our team has been training new hires extensively. We actually have another new hire starting next week, and then we'll have two more in the middle of January. So just really want to acknowledge the great work that our team is doing, and not only maintaining their workload, but also training on their new teammates. Our land development team has recently started outreach to our realtors. The realtors have asked for information on how they can best assist when their clients are buying or selling a property on septic. So they have started making presentations to realtor groups that have been very well received. And then we also have a project. We have a number of different public water systems in our area. And so we are starting a project to better be able to identify that when an issue is identified with a public water system, which permitted facilities such as restaurants or childcare facilities or those types of facilities are impacted by any issues with those water treatment centers. And that is it. If you have any questions.
That last project sounds like a pretty important one that you'd think you go, wow, because when we have problems, we need to know pretty quick what's going on.
Yes, and we have a structure right now. It's just a little clunky, and so we're making it a little bit more efficient.
Very good. Any other questions, concerns? Thank you for the update.
Thank you.
And come on down. We have Dr. Dow. At some point, we should take these out of order so she doesn't feel like she's always last.
I'm always last. That's how I can time my bathroom breaks. Oops, I just sat down camera, sorry. Good afternoon, Mr. Chairman, members of the board. This is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. To highlight on my report really quickly is that I do want to highlight our outbreak numbers. This is in line with Mr. Health Officer has already said. With the increase in respiratory diseases, our outbreak numbers has increased 43% from October to November, and the majority of the 70% are in respiratory illnesses related outbreaks, and a majority of these respiratory illnesses are in RSV confirmed. So that is the trend we are seeing right now. RSV is dominating even in outbreaks. We're seeing that mostly in preschools and in daycares. And that's all my update. I'm happy to answer any questions.
Thank you. Any questions? I don't have any. Thank you so much.
Thank you.
Let's go ahead and take it to District Health Officer Kevin Dick for an update.
Thank you, Mr. Chairman. I just wanted to highlight a few things in my report, and that is that I reported on the BDR for the Central Nevada Health District. On December 2nd, the State Board of Health met, and they approved the creation of a Central Nevada Health District, and that is a health district that is the counties of Churchill and Mineral and Pershing counties and the city of Fallon at this point. And the county of Eureka is participating on a contractual basis in that. And the reason for that is because currently NRS provides for the creation of health districts with adjacent counties. And so the BDR is to remove that word adjacent so that Eureka County can then formally join as part of that health district and participate on their Board of Health, et cetera. But I think it's exciting news that we have a new health district in Nevada serving those counties. And I think that while they've been talking about and exploring in Churchill County establishing a health district, their experience through the pandemic really motivated them to move forward and to get this established. And then I also wanted to report on our work as an academic health department. The Board of Health several years ago approved our establishment of an academic health department relationship with the UNR School of Public Health. We had them here earlier today for the scholarship. But we really haven't been as active in that engagement during our COVID response, and we're getting back involved with that. And Dr. Dow is really leading that for us with the health district. But we had a really nice mixer on November 17th where we had the dean and their department chairs come over and meet with our division directors and some of our supervisors for them to learn more about what we're doing and us to learn more about what they're doing. And next semester we'll be providing with them a seminar on public health practice where we'll be providing seminar lectures to cover half of those seminars through the semester. So we're continuing to develop and move forward, and I expect we'll see more engagement. We're also working with them on internship opportunities over here. And then on our public health accreditation, I just wanted to report to the board that we have submitted our annual report to the Public Health Accreditation Board. That's something we do every year to report to them on our efforts to maintain our accreditation, and so we remain in good standing on our public health accreditation. With that, I'd just like to wish a peaceful, joyous, and safe holiday season to all of our health district staff and to the board members and to everybody in our community. So, thank you very much.
On our accreditation, what typically accreditation goes for so long and then you had to come back in and do all the accreditation again. What's our timeline on that?
I believe it's 2024 that we do the reaccreditation. We were accredited in August of 2019, and it's a 5-year process. I'm looking to see if, Ms. Ratty is nodding her head yes, so.
Okay. Well, and I'll go ahead and dive into 15 with board comments. One of the things I think we should bring back is an update and explanation of what that means. How many other health groups are accredited? Why do we care that we're accredited? And then what's the process? We have a lot of new board members who may not understand that, and I was a part of when we did that, but I think it's a crucial element to that. So, any other board comments before we close our time together? Got anything, sir? Clacking? Okay. With that said, I also have a great season. Be careful, be kind. I tell you what, kindness goes a long way. Have a great day. This meeting is adjourned.
Thank you.